We do have quite a few people on the phone, but I thought we would just quickly go ahead and I'd let you all introduce yourselves. Just please state your name and what state you are from. That would be great. And again, unmute yourselves to introduce yourself.
Hi, Jill. This is Leanne Winchester from Massachusetts.
Welcome.
This is Cheryl Nevada with Nevada Aging and Disability Services Division.
This is Marilyn. I'm sorry. This is Marilyn Sword with the Idaho Caregiver Alliance and the Idaho Lifespan Respite Coalition.
Tina Yerk with the Illinois Respite Coalition.
Maggie Lyons with the Illinois Respite Coalition.
This is Easterfields in Delaware.
Liza Gundell, Family Resource Network in New Jersey.
Connie Siskowski, Florida.
This is Lori Stahlbaum with the Administration for Community Living.
Hi, this is Jeannie Delaplane from Washington State DSHS Alta.
Hi, this is Robin Boswell with Lifespan Respite Voucher Program in Oklahoma.
This is Jill McCormick, Lifespan Respite Washington PAVE.
Schneider with Respite Station in Wisconsin.
Anyone else with us today?
Jean Sherman, Lifespan Respite, Florida.
Tracy Kahlo, Respite, Washington.
Josh Hubin, Department on Aging, South Carolina.
Ann Mangelsdorf, St. Louis ARC.
Naomi Duffert, Maryland Department of Human Services.
Patrick Kelly, Montana Lifespan Respite Coalition, state of Montana.
Anyone else? We do have a number of people who've identified themselves in the chat box as well. Ben Stromberg from Nebraska, Jean Boras from Texas, Abby Lavazzo, New York, Joe Ward, South Carolina, Catherine, Megan, and Amy from Colorado, Dana Howarth from New Mexico, Rachel Watkins Peterson from Wisconsin, Lisa Hoskins from North Carolina, and Aita Stevens from Oklahoma. Anyone else? Nadine Walters also from Oklahoma. Anyone else? Tracy Dunklin from Alabama, Deirdre Dunn from New Hampshire. Did we miss anybody?
Oh my God.
Thank you so much. It's really helpful to know who's on the call, and I'm really heartened again that we've had so many of you return. We did have a very informative and enlightening call last week, if you were with us. We heard from so many of you about how you're adapting your respite services to better meet the needs of family caregivers during these very challenging times. And your need for information really prompted Arch to go out and take a look at all of the multiple national and state resources that are now available around the pandemic. And they're posted on the Arch website, and we've been updating these resources frequently since last week. You can actually find them all on this website right here. I added some even this morning as they're coming across my desk. So I hope you'll have a chance to take a look at this. I've really tried to comb through all of the information and pick out the things that are most relevant to caregiving and respite services. I did want to point out just a few of those noteworthy resources that have come to our attention during the past week. This first one was actually a statement that was released this week from the major national caregiving groups, and I was very proud to be invited to be part of this statement. And it really is the intent of this was really to raise awareness about the needs of family caregivers at this critical time, and to demonstrate that we were all speaking with one unified voice. So again, if you have a chance to take a look at that statement, and feel free to use it and post it however it'll be most helpful for you. These particular resources I thought were especially noteworthy because they address issues around COVID-19 when it comes to self-direction. And since so many of you are doing respite voucher programs and participant-directed services, I thought you would appreciate these resources. Applied Self-Direction was formerly the National Resource Center on Participant-Directed Services, and they really have some wonderful resources. This first one, for example, why states should expand self-direction. In this resource, they've highlighted some of the key reasons self-direction is especially useful during this emergency. So again, I urge you to take a look at these. Many of you talked last week about designating respite workers as essential workers, and they've actually developed a template for a identification badge and letter, if this would be of use to anyone. And then finally, the measures and strategies for self-direction talk about all the different ways that states are modifying their participant-directed or consumer-directed programs to deal with the current crisis, whether it's within hiring and enrollment or service flexibilities. And again, many of you talked about that last week, that you've changed your eligibility for who can provide respite to include people who are living in the home or family members. So this document gives you a few additional resources that might be helpful. And then these last two slides I wanted to point out because we would love to have more information from you as well, because it's helpful to, with ARCH being the repository of information, we're trying to be as inclusive and complete as we can. This first one actually came up with the International Short Break Association as we were discussing whether we needed to postpone the International Respite Conference. And as you know, European countries especially were hardest hit initially after China, of course. And so they were really interested in how other countries around the world were helping to support caregivers as the pandemic was encroaching upon their countries as well. And so Kim Whitmore, who is at the School of Nursing at the University of Wisconsin, who is the chair of the International Short Break Association now, and we were partnering with her and with the Respite Care Association of Wisconsin to host the international conference. She's put this survey together with all of us as partners to see what the global impact of the pandemic is on respite care and help to identify some best practices that they'll disseminate quickly. So they're asking people to, again, this is the same kind of information
on a Zoom call.
That
this lady in her bedroom. Do you realize I can see
I've
your
got to
room
mute a few
and your
people.
dog?
Please mute yourselves if you haven't done so. You can unmute yourselves when you have an opportunity to speak. Thank you very much. So this survey, we're asking people to try to respond to it by April the 15th. At the same time, ARCH put out through its Lifespan Respite Exchange some questions asking for tools and resources that you're using through your Lifespan Respite grants, through your voucher program, or any your local community or faith-based programs. We'd love to, again, be the repository for information about ways to cope with the crisis and provide supports to caregivers. So you can either, if you're a grantee or a partner, you can post your ideas on the Respite discussion forum at that link, or just send them to ARCH via email. I want to open it up to all of you now. Again, we don't have any formal presentations on this call. You had all asked that we schedule another call so that you could get updates from each other, perhaps new ways that you're helping families or new issues that have arisen, new challenges that you're trying to deal with. And I open it up to all of you now. So if anyone would like to kick off the conversation, we would love to hear from you. Or if you have questions for your colleagues, please go ahead.
Jill, this is Marilyn in Idaho, and I just wanted to share something that came out of a meeting we were in yesterday. And one of the things that we talked about was kind of how to reach those people who may not have the internet, may not have a computer. And so we've been talking with AARP, the Alzheimer's Association, and our AAAs, among others, and the health district to get out information, perhaps through some door knockers, that if we could get decide exactly what was the key information that people needed to have, and then get that printed up on door hangers that people we could recruit some volunteers to just take those door to door and put them on people's doorsteps, because that may reach a lot of people that we wouldn't otherwise reach. We haven't done anything with that yet, but that was a discussion that we had yesterday.
I think that's an excellent idea, because we are aware of so many. I mean, we get so many calls here at Arch from people who do not have access to the internet, which is one reason they're calling us, because they simply don't even know where to go to get help. So that's a really wonderful idea. Are any other states doing something similar?
This is Cheryl in Nevada. I don't know if other people are utilizing Facebook or other social media platforms. A lot of people have smartphones. They may not have internet connection or whatever, but they can access resources through their smartphone. And so to have some social media posts on Facebook or other sites that will be easy to disseminate. We've had some success doing that.
Great idea too. Others using social media?
Hi, this is Tina from the Illinois Respite Coalition. And the first thing I wanted to say is that we were all really motivated by last week's call. So thank everybody for your information. And that got us going a little bit here. We've updated our Facebook, and with our Facebook, we're doing quarantine questions, one a day that people could submit. And the whole idea too is to create content during the week that addresses the caregiver's needs, any kind of resources they may be looking for, or any kind of tips for maintaining, a strong social and emotional and physical health. So we're doing that on a daily basis. And then when the board was together yesterday, we thought about doing something that's fun. And the one thing that was discussed is what's going on right now is the 10 push-up challenge. And we thought, you take the challenge and then you post it, and then you recommend somebody else for it. And we discussed, making sure that that other person would agree ahead of time. But what a way too to show different ways to do push-ups, and something that's a little more fun and light, and then trying to do it with different agencies and providers throughout the state.
Wonderful. Thank you for sharing that. Go ahead. I'm sorry. I didn't mean to interrupt.
No. And the only other thing that I didn't say last week that I wanted to is that the Illinois Respite Coalition, we revised the Wisconsin training that they had on their website a while ago with their permission. And we have always heard such great feedback from people taking their test. So I wanted to thank Wisconsin. We've been using that for a while. We had previously gotten permission to do so, and we have it on our website that it's theirs. A great training.
Do you mean their general training or the most recent one that they are doing around the COVID pandemic?
Well, you know, this is their one to get certified as a respite worker.
Yes. Okay.
Yeah, but Maggie is on, and Maggie listened to their daily one.
Yes, thank you again,
Yes.
Lisa and Rachel in Wisconsin, for sharing that with everyone. I think people were very grateful to have that information.
Glad we could share it with you.
Thank you so much. This is Maggie. Thank you so much. It was a wonderful training.
Oh, thanks, Maggie. Glad to help.
Yeah, absolutely. Anything that we have on our website, because it's state funded, there's no proprietariness. So feel free to use any of the resources because they're free for anyone.
So generous.
Yeah.
We do have a comment here, a question from Connie in Florida. She's wondering, she says some of their families are hesitant to have a respite worker come into their home. And I know we talked a little bit about that last week. And I think Lisa had some materials that help assure families about the providers that are available. But also Connie said they're having resource challenges with financially insecure and undocumented families, and wonders if anybody else is experiencing those challenges and what they're doing. Those are probably challenges we face all the time, but especially difficult now.
This is Anne at the St. Louis ARC, and we have some families who are using less respite care because of their concerns about the virus and using respite workers. We also have folks who are wanting to use more respite care and have people that in mind that they trust already and have in place. We have also temporarily lifted the requirement that the person that does the care not live in the household. So it still cannot be the primary caregiver, but it can be another family member like grandma or a sibling or someone, an older sibling in the household, or people home from college. So we've lifted some of our requirements to allow for some of that.
So this is Connie. What's happened in Florida is that since we have so many youth caregivers who didn't have a laptop even, so the schools gave them laptops, and some companies offered free internet access for 60 days. So some families that didn't, have a computer before now have one, at least on loan. But then in order to get the internet providers are kind of doing it as a loss leader. And so they're really, looking for a free 60 days and then a new customer. And so they're requiring ID, but many families don't have the ID that they would like. So it kind of defeats the purpose. And my concern is, that there will be a growing disparity that we'll have to all work on to catch up with when this is over.
Yeah, absolutely. I actually think this is a universal problem. Our agency, our fiscal agent, provides large numbers of Head Start programs in North Carolina, and they've been trying to provide a lot of educational programs via the internet and resources. And they've discovered that many of their families do not have internet access, and they're not reaching those families at all. And those kids are going to fall farther and farther behind their peers in the Head Start program. So it's definitely an issue for caregivers, but I think because we've switched almost so exclusively to internet resources, that it's going to be hard to ensure that everyone has the same information. Anyone else want to comment on that?
And especially families that need respite. If you don't have a way to contact them, it's really challenging for them. And I've heard of 2 recent suicides, and I just, I'm concerned that that's going to be a growing issue. And so the need for support is greater than ever, I think.
This
What
is
do you
Lisa.
think about Marilyn's initial, Marilyn from Idaho, about going door to door?
Yeah, I think going door to door is good, but then, you know, it's going to take a team to be able to do that.
Right.
Hey, Jill, or this is Lisa from Wisconsin. I wanted to bring up two things. One, in regards to the iPads and stuff. Do many people use or refer people to the NFCSP program or the National Family Caregiver Support Program? Because you are, at least Wisconsin is allowing it to be able to have caregivers purchase iPads through the NFCSP program. So I'm assuming that's a national program, unless they're using it for the AFCSP. That I don't know for sure, but it's worth looking into for your state. I do think it was it's one of them. The other one that I wanted to share was we here at Respite Care Association, we're just talking this morning about our Caregiver Respite Grant, which is a lot of people's voucher program. I don't know if this is a CMS level, but here in the state of Wisconsin, they've limited the CLTS waiver program, that there are no face-to-face services that are allowable right now with the CLTS waiver. And I'm not sure how they're, what's going on with other families, but what they're doing is for essential workers, they're going to allow them to use the CLTS waiver monies to put their kids in childcare. And so we're looking at utilizing our respite care grant program monies to kind of fill the gap for essential workers to use our monies for either somebody to come in the home or to have their kiddo go to a daycare until they can get the children's long-term care waiver in place. We're going to try to fill that gap of time.
Thank you, Lisa, for sharing that.
Jill, this is Cheryl Donnell from Nevada again. One of the things that we're seeing is an increase in the need for a backup or a secondary provider because of the limits of the providers in our network. We can allow a caregiver to have 2 providers on their contract. So if they're stuck at home and there's somebody at home that's with them, that's either come to their rescue or is a neighbor or whatever that they feel comfortable about having in their home, they can sign on a second provider on their contract. And we've had an increase in people trying to do that, get a second person, backup person that can be funded under that, and so that family and neighbors and people that are closer at hand can provide some additional support.
Thank you. That's a great idea. As a result, I remember Ann last week talked again about modifying eligibility, and Cheryl just talked a little bit about it in terms of having backups. Have any of you also thought about modifying the amount of the respite voucher, or again, modifying who's eligible to be a provider to try to continue to reach family caregivers? Or are you finding that there's just more and more of an obstacle of being able to bring providers into people's homes? Again, as Ann said, they have some people who are asking for more respite than before, while most people are saying, I really don't feel comfortable with someone coming into my home.
This is Ann in St. Louis at the St. Louis ARC, and we have been very fortunate in that some of the funders who are funding the voucher program are allowing us to have additional funding, which has been very helpful. One is more generous, one a little less generous, but they are looking at those considerations and allowing for additional funds.
for some of you that are grantees and you know that you're not expending funds at the same rate that you were expending them before, have you considered, for those people that still want some respite services and you're administering vouchers, have you thought about increasing the amount, the dollar amount?
This is Cheryl in Nevada again. We have gone through our participants to see who is having an impact and who is not. And those that are flagged as being able to either having to suspend or not being able to access their respite resources, we are considering increasing the amount of funding that they have. And we're hoping that restrictions will be lifted so that they can actually use it at some point, because of course we want to spend down our funding. But if they can't access it right now, that's a real challenge. Until they can, we haven't got it an amount that we've approved, but we are flagging files for those that would be able to maybe have an increase in the remaining months of our grant so that they can hopefully spend down the funding and get caught up, maybe you could say, on their respite that they didn't receive in the meantime.
Great,
Jill, this is Nadine from
Mhm.
Oklahoma.
Yes.
We've kind of looking at ours a little bit, just trying to figure out kind of how to wrap our hands around it. But, you know, we let the caregiver hire the providers, the care providers. And we've always said that it had to be someone outside of the home. And we have a letter of request to allow the caregiver to hire, you know, individuals that live in their home that are over 18 years old. So we're listing that. We're probably going to increase the amount. We do $300 every 3 months. We'll probably lift that. We've been a little cautious just because I kind of feel like, you know, right now things have slowed down, but we feel like when this lifts a little bit, they're going to really need respite and we're going to get flooded, we think. So we're trying to kind of balance the budget on that. One of the things we're doing is calling caregivers, and because they don't know these new guidelines that we're kind of lifting. So calling them is probably the best opportunity for us. I get a little nervous going door to door when we're supposed to be indoors ourselves. So I think calling is an opportunity because we have that information on file. Aida and Robin, have I missed something? Okay, well, they're not responding. So anyway, just wanted to give you a little update on Oklahoma.
That's great, thank you. And calling, of course, is an excellent alternative to going door to door or using the internet. Several people have raised in the chat box that going door to door is now not possible in their state because of you know, restrictions going any place other than the grocery store or the drugstore. But I'm wondering for states, I know New York has a tremendous number of volunteers that have come forward to assist the aging and people with disabilities. And I'm wondering, are there special exceptions that can be made for volunteers to do that kind of communication with neighbors and communities? Or that would allow that to happen?
Are you saying the volunteers go door to door?
Possibly. I don't know who would be good.
I don't.
This is,
I'd want my,
hi, ladies. This is Aida, and just to chime in, our coordinators have been doing check-ins as they can by phone or through social media or by email, because again, here we're a stay put state, but we have tried to recognize those that don't have access to internet and just do a check-in by phone, as Nadine said. It has worked very effectively. If nothing else, even if the caregiver at this time chooses not to access a provider, that it is, I think, good emotional support during this time, and that's what we have found.
Thank you. Anyone else using the phone more extensively than other means of communication, or using it just as extensively?
Yes, this is Ann. I'm using a lot of email and phone. And for a lot of folks, phone seems to be the best way to communicate. This is in St. Louis.
Anyone have any other, if we want to move off of maybe the communication issue, to start talking about some other alternative services or creative ways that you're working to bring a break to the family caregivers you serve or support them in another way?
It's Connie. For the kids, we're trying to do some virtual activities like a virtual field trip and some stress buster contests. We have somebody who is an expert in tapping to relieve stress. So some other stress management techniques by using Zoom.
Great, thank you.
This is Lisa in Wisconsin. We were just talking this morning about exploring the use of paying $13 for the Calm app to be used by caregivers. So I think we may be going in that direction. At least for $13, they have access to things that help them with peace of mind and sleep, rejuvenation. So for $13, I think it's going to be worth it.
Great, thank you. Anyone else?
Can you hear me, Jill?
Now I can, yes. I'm sorry, Doris, I had to mute you earlier because we had a lot of background noise from you. Go ahead.
It's so hard. So the agency that hosts the Coalition in New York is doing a few things. One is that they immediately posted a request for community volunteers on the agency website and on the United Way website, and I think several other agencies. So we're fielding all those calls and connecting them to older adults, isolated adults, caregivers in the community that would really benefit and appreciate a call every week from someone. So it's engaging community volunteers. Many of them are older adults as well, to connect with folks in our community. It's pretty cool.
Yeah, I think that's pretty amazing. Anybody else doing something similar?
We're also posting, our caregiver department is posting daily exercise and meditation, a half an hour at the same time every day, and then letting caregivers know that that's an available option for them.
That's great. Anything else like that happening through your state aging or disability agencies?
This is Jill McCormick from Washington State, and my husband works managing a senior center, and I know that at least in the Western states, the senior center directors are kind of connecting and looking at ways to do the virtual activities, to do phone trees, to connect with the seniors who are connected with their senior centers who may be more isolated, who are having food insecurities. They're looking at ways to provide outreach to those folks that they're connected with.
Great, thank you. Anyone else want to share a great idea?
Hi, this is Veronica from Family Resources. We're similar to the meditation. We're looking to provide some ongoing stuff through social media with our Get Fit exercise and nutrition program, as well as something meditation, Zumba, something to just keep our families, you know, engaged through social media, at least over the next month or so.
Great. Anyone else? I learned about something that I wanted to mention to all of you just again this morning. There's so much flying through my inbox on a constant basis. The National Direct Workforce Alliance, I believe that's the organization, has made an emergency fund available to direct service workers that would include you know, personal care assistants, home care aides, even family caregivers in some states. And they're partnering with some state caregiver coalitions. And when I say caregiver coalitions in this context, I mean the people, the paid caregivers who provide care. And I'm wondering, we've been talking a lot about family caregivers. For those of you that are trying to support and sustain a respite workforce, are you offering any supports to the respite workers themselves to get them through this time? This National Direct Service Workforce Alliance, for example, has partnered with the New Mexico Caregiver Coalition to help get the funding out in their state. And I'm wondering if this is something that other coalitions might be able to participate in. It's actual financial assistance. It's pretty minimal. I think it's like a $400 grant to someone who has an income from providing direct care or respite, no longer has an income. And I'm wondering if there's interest in learning more about that program. Or if you've had questions from your respite workers or the agencies that you work for that are struggling to get by right now. You know, it's a ripple effect. We stop providing the respite vouchers or the mini grant funding, and everyone else gets affected as well. Not an issue. Okay, that's interesting. If you go to the ARCH website, Cheryl's asked me if I could provide more information on that, and I'm sorry I don't have it right at my fingertips. But if you go to the ARCH website, again, this link on this slide right here, under Lifespan Respite Resources and State Resources, there's a link to the National Direct Workforce Care Alliance and to the grant program. So you can learn a little bit more about that. I can send around the link afterwards as well, so in case you can't find it on the ARCH website. I'm not sure where they're getting their funding from, but I thought that was a very interesting little bit of resources. And Lisa has just said, to clarify my comment earlier about being able to purchase iPads, her contact responded with this. Well, either program, but for the National Family Caregiver Support Program, they would be able to borrow them from the ADRC, not necessarily to keep, or allows them to purchase. Each agency is different though, so it depends on the county, tribe. In regards to internet service, temporary during COVID, you should be able to use the same sources. However, it could be different in your state. And I'm wondering here, that raises issues, Lisa, about state technology programs, because they often lend out equipment. And I don't know if some states are able to loan out iPads or other means of access to the internet. For those of you that are involved with your state technology programs, have you heard anything about that? I wish someone from Alabama was on the program, because the Alabama Lifespan Respite Network has an amazing connection to their state technology assistance program.
We here in New Jersey have an assistive technology program where we have funding from Department of Children and Families, as well as our division, and that program is running almost fully operational, believe it or not, with the contractors still being considered like essential employees. And so we've been able to, at this point, keep that fully operating.
Yeah, that's wonderful. Do they loan things like iPads or laptops?
For our particular service, we actually purchase or we fix some of the assistive technology, depending on the request. We also do things like home modifications. But with the assistive technology, it's usually they purchase it, we fix it, or they have something that we're modifying to make it accessible.
Okay, Cheryl says in Nevada that unless there is an essential need, that their program isn't taking new applications. So I guess it's going to be different in every state. And that very important designation as essential, how is that affecting the work that you're doing? If you don't have that essential designation, it's hard to provide a lot of services or be out in the street. Okay, does anyone have any other questions for their colleagues or any other issues they'd like to raise this week? Or anything they'd like perhaps Arch to investigate a little further and bring it back to you all?
Yeah, it's Lisa in Wisconsin, and Bill, you probably know because the call got canceled at 1 o'clock. But we have an opportunity to go after a grant here in Wisconsin through UW-Madison about, we were looking at disseminating PPEs, but the biggest issue is getting PPEs to these people who are self-directed and hiring their own employees under their long-term waiver programs. How are you guys getting PPEs to, the people who are employing directly versus the large agencies that have big bargaining power?
Anybody want to respond to that? I mean, that might be a great question for me to put to our friends at Applied Self-Direction to see if what they're hearing on that issue. That's the resource center I mentioned earlier that's put out the resources on self-direction in the time of COVID. And when Lisa says PPE, she's talking about personal protective equipment. Is that right, Lisa?
Yes.
So this is Veronica again from New Jersey. We've made a full court press only in recent weeks to try to obtain some of the PPE that we need, and disseminating has been an interesting process. I'm actually going through it right now. We happen to have key staff we've identified throughout the state in which we're getting the equipment it's sent to each one of them locally. And then we're doing an outreach to our direct support staff in order to try to get it into the right hands. It's been a very interesting coordination and certainly a new process altogether. So we're figuring it out as we go, but we're in it right now.
Uh-huh. Anyone else dealing with this issue that has anything to share? Any other updates? New ideas? Challenges you're dealing with that maybe you could get some help? Yes?
This is Robin in Oklahoma, and I just wanted to mention that April's Autism Awareness Month. So I plan to reach out to our state autism organizations to let them know that respite is still around, and we still want to serve caregivers at their time of need. So that might be an opportunity.
Yeah, great idea. April is also Child Abuse Prevention Month. So for those of you who work with vulnerable families and you think respite might be helpful to them, perhaps that's another way we can work to get the word out. If, again, those states where you have supports to actually offer to families, that might be helpful.
Jill, this is Cheryl Nevada again. One of the webinars I participated in last week was about coronavirus preparedness for people with chronic disease. And one of the things that they were mentioning is the number of new caregivers that were being generated as a result of the COVID-19 restrictions, and that we needed to do a better job of getting information out to new caregivers, which is really difficult because if you don't have an established relationship with them, you don't even know where they are. I know our program struggles with the idea, but I wondered if anyone else was encountering brand new caregivers that needed information and direction as a result of being pressed into a caregiving role at this time. Has anyone had any dealing with that?
I think that is such an excellent point, because I have already heard from caregivers who perhaps before the pandemic were able to utilize adult daycare services, and now they can't. And they're not even used to providing care and support all day long, who have lost other support services or had to travel to stay with parents or to siblings with disabilities because they lost their direct support. It's true. How do we even find these people? Any ideas?
Facebook, websites.
Again, I think if, for those of you who are involved with state respite coalitions, using your coalition partners, for example, if you have members of the ALS Association or the MS Society or the ARC or other organizations where that might be a way to identify families through their associations. But I'm sure all of you are communicating on a regular basis with your coalition partners to get the word out. So many of you have typed in here that you are using Facebook and social media for reaching your family caregivers, using it pretty consistently and successfully.
Jill, this is Marilyn in Idaho again, and that same group that was talking about the door hangers also has been focused on kind of the southwest corner of Idaho and working with the health districts and independent living centers and just a wide variety of partners, talking about this whole issue of what happens if you have paid staff and they either agency or non-agency and they don't show up. Who do those people call? And how is that kind of triaged in terms of getting those people medical support that they need or just, I don't want to call it social support, but regular support. And so that's been an ongoing discussion that we've been having for the last couple of weeks about how do those people reach out, and then how do we reach them, and kind of how do we proceed from there, and making sure that if there's backup, is that safe and is it appropriate? So that's something we've really been wrestling with.
Anyone else wrestling with that and have thoughts for Maryland and Idaho? I guess everyone's wrestling with it, Maryland. Haven't come up with any ideas yet. That is a very difficult situation. Having that emergency plan in place, and it's hard to have an emergency plan in place when everybody is in a state of emergency and caution.
That's it. Mm-hmm.
Yeah, exactly. We all have to be the backup for the backup, and then we need backup.
Exactly.
There's a question from Connie here. She'd like to know if anyone has tried Zoom for a caregiver support group.
Hey, this is Josh in South Carolina in the Department on Aging. I just got off a call yesterday with the ARC of South Carolina. It's ARK, so different organization, but they do the leadership training for the Powerful Tools for Caregivers program. And I know that they're in the process of shifting support groups and also their Powerful Tools for Caregivers over to an online platform. So we don't know how that has gone yet, but we should be hearing back kind of about that success here next week. And I could respond via email if that goes well. It would be a good option to try other places.
Great, thank you. That would be great to hear about. I mean, I would suspect that Zoom would be a great platform because it's relatively easy to use and it has a camera so everyone can see each other if you prefer to use that. Deirdre in New Hampshire says, yes, one of their family support groups uses Zoom. And Marilyn said she would like to hear more about shifting Powerful Tools for Caregivers to online. So we'll wait to hear back from Josh about that. People very interested in the Zoom approach. Any other last minute thoughts? Questions you'd like Arch to explore that we haven't touched on? Well, if there are no further comments or questions for anyone, I think we can bring this call to a close. We only have 5 more minutes left anyway. I hope you all have a very pleasant afternoon. After you hang up, if you think of a question, please forward it to me and I can share it with the group. Again, I encourage you to respond to those 2 surveys. Well, one is a survey and one is a request from us to send us your ideas so we can get them up online. And I will pull what I heard today on the call and try to capture it on the website if there's specific enough information. But also please send it to us via the Arch discussion group. If you're a grantee or partner, you do need to log in and be a member to use the discussion forum, or just send it to me via email. And this international survey, we'd all love it if you would share the same information or other ideas. And I think we will get back some incredible ideas from what other countries are doing as well. So stay tuned for that information as it's pulled together by Kim and the Break Exchange and the International Respite Association as we move forward. Any other last comments? Have a great afternoon, everybody, and have a very safe week and be well. Thank you all for joining us today. Take care, everyone.
Thanks, Jill.
Thank you all.
Thanks.